Hi, I'm Renee, and this is my presentation on hearing loss in children. Ear anatomy. The ear contains three main parts, which are the outer, middle, and inner ear. The outer ear includes the auricle, which is the physical ear that we see from the outside, the auditory canal, and the tympanic membrane. The middle ear contains the eardrum, tympanic cavity, and ossicles, which are small bones that feel the sound wave vibrations. And the inner ear includes the oval window, semicircular ducts, cochlea, and the auditory tube, which not only helps with hearing, but it also functions in balance and equilibrium. But how do we hear? The sound waves first travel through the ear canal until it reaches the eardrum. The eardrum then passes vibrations through the ossicles, or the middle ear bones, into the inner ear's cochlea. The cochlea's hair cells surrounding it change the vibrations into electrical signals that are then sent to the brain through hearing nerves. Once the nerves reach the brain then tells us what we're hearing. But hearing loss in children. It's usually not detected until around 2 years old when the parents notice that they haven't started talking yet or they haven't reached their milestones. But how do you screen this? You can screen this now as early as 24 to 48 hours with the advancement of technology. One of the ways you can do this while they're getting older is to monitor their speech and hearing milestones at different age groups. For example, from birth to 4 months, they should be able to startle at loud sounds and react to voices. From 4 to 9 months, they should be able to notice that toys make sounds and turn their heads towards the sounds and make babbling noises. From 9 to 15 months, they should be able to repeat simple sounds and understand basic requests and respond to their own name. From 15 to 24 months, they should be able to name common objects and follow basic commands. What are the causes of childhood hearing loss? Well, they could be differentiated into 3 different types: congenital, which is since birth, acquired after birth, and fluctuating or transient, which is just a temporary hearing loss. The CDC also states that there are around 5 out of every 1,000 children that are affected by hearing loss each year. However, there are more and more cases of this as time goes on. Congenital hearing loss is a hearing loss that is present since birth, and it can be separated into 2 different factors: genetic and non-genetic. Non-genetic factors include birth complications such as infections while giving birth, premature birth, nervous system or brain disorder, the use of antibiotics or NSAIDs, maternal diabetes, drug or alcohol abuse by the mother. And genetic factors include autosomal recessive, in which both of the parents carry a recessive gene for hearing loss that pass it on to the child. Autosomal dominant, which is when only one of the parents has a dominant trait for the hearing loss, but it still gets passed on to the child. Or genetic syndrome, such as Down syndrome or Usher syndrome, that the child is born with, which can lead to hearing loss later on. And sometimes the cause is just unknown. Acquired hearing loss could be from external or internal factors. For example, an internal factor would be perforated eardrums, which is a damaged eardrum, which could also be from exposure to loud noises or head injuries. Otosclerosis, which is the formation of bone in the middle ear, which should not be there, as seen to the image on the right. Or infections could also cause this hearing loss. External factors could be exposure to the loud noises, head injuries, untreated or frequent otitis media, or exposure to secondhand smoke. Transient hearing loss is a fluctuating hearing loss that can also be temporary and is mainly caused by otitis media or middle ear infection, which is caused by the buildup of fluids in the ear. What are the treatments for hearing loss? Well, for children, they are able to receive hearing aids, cochlear implants, speech therapy, and assistive listening devices. Hearing aids, as seen to the top right image, you can see that it'll enhance their hearing, as well as the cochlear implants. You can also see them from the outside, however, it requires surgery because it stimulates the auditory nerve in the inner ear. Speech therapy will just help the child with talking for the future. But how do you help children cope? As a parent, you have to understand and accept your child's hearing loss, try to raise them as normally as possible and not restrict them on their enjoyment of life. let them live out their dreams and aspirations, and always provide support, patience, love, and reassurance, and teach them self advocacy and responsibility for their own hearing problems. And here are my references. Thank you.